Dr. Mobley here. If you've had any sort of face or neck surgery with me, that's why you're receiving this video. A lot of helpful tips. A lot of these things are in writing in some of the documents we give you, but it's nice to kind of see a video just to kind of summarize everything. So first and foremost, if you're your first couple nights at home, rest. Okay, take it easy. People that get up and are too active are always the patients that go on to have some sort of minor or not so minor post-op problem. So take it easy and rest. It's good to get up and move around just so your legs get some motion, but it's light, early mobilization. Nothing that's strenuous. Don't take your dog for a walk. Just pretty much stay on the couch and make small walks around your home. That's most important. Use some ice. If anything's aching, put some ice against it. You're going to have a big puffy dressing, but you can still take some ice and say like a Ziploc bag, place that against the dressing, and it will provide pain relief. Hydration. Stay well hydrated. You'll feel better if you have some good hydration in you. Sometimes sports drinks are too sugary, but if you dilute them 1-to-1 with some water, they work great. Next thing would be deep breaths. Any type of anesthesia, local anesthesia, sedation, it can cause your lungs to sort of not be at their maximum expansion. So when you're laying there in bed once an hour, make a purposeful effort. Take a big breath and think about expanding your lungs from top to bottom and side to side and hold it for 15-20 seconds. Let it out. Repeat that 2 or 3 times. So again, you're expanding your lungs top to bottom and you're expanding them side to side, and that's really healthy for your ventilation in your pulmonary system. Some more technical issues. Most of my patients, not all, but most are going to have a surgical drain placed after surgery. The drain is going to look something like this. There's a whole separate video on the website that talks about how to strip those drains. You want to do that once every hour for the first 48 hours. Very important. When you're done stripping, make sure that this thing, we call it a grenade, kind of a little cute name. Make sure the grenade is fully compressed, that the little cap goes back on, and that must stay compressed. If that expands, something could be wrong, and you should send me a text so we can troubleshoot. That must stay compressed. Also, another tip that we've learned over the last several years, it's very normal when you sleep that you kind of fall asleep and you slouch. That can create lines in your neck that will go away, but they take time. So prevention is the best medicine. Take your standard airport pillow, wear it in the reverse configuration, and that way, when you rest, your neck can't go down that far. So the best you can, sleep with your chin up, but use the reverse placed airplane pillow to keep from getting any funny little neck lines, which again, we can fix, but they would slow down your healing. If you follow these tips, read all the stuff we gave you in writing, but we hope this video gives you a high-level summary of the things that are most important for the first, say, 1 to 3 days after any sort of significant face or neck surgery performed by me on you. I wish you a speedy recovery.